And ito this time around, Doc Annie, we'll be discussing naman yung diagnostic measures and yung management of, asthma. Okay, so ito, no, paano natin nadadiagnose yung asthma? Is it clinically ba? Okay, or kung, ibig sabihin, kung paano natin nakikita yung pasyente upon seeing him or her, or meron ba tayong mga nire-request pa? So we can come up with a confirmatory diagnosis of bronchial asthma.
So, that's true, no? It's still clinical. You have to go to your pulmonologist, syempre to confirm, is this asthma or not? Or, of course, kailangan din ma-rule out kung may mga infection. Pero when it comes to confirmatory test po, we call it spirometry, no? Or yung pulmonary function test, wherein the computer will actually measure po kung gaano karaming hangin yung nailalabas nyo galing sa baga. And we compare it sa result na after giving you a bronchodilator o yung gamot katulad ng salbutamol na nakakapagpaluwag ng daanan ng hangin. And then titignan namin kung makipot ba talaga, may change ba talaga. So, mako-confirm namin kung may HIka yung patient.
I see. Okay, so basically, para ma-confirm siya, or basically pag clinical muna, clinical yung diagnosis natin, it has to be during an attack.
Unfortunately, because asthma is innate, di ba? Lalabas lang yung symptoms kasi if you are presented with the triggers. And unfortunately, sometimes when a patient goes to your clinic, minsan wala silang symptoms eh. They look like a normal person.
Yeah, oo.
So, itong mga test na to yung talagang makakatulong na ma-confirm.
How about when we deal with parang an older patient? Kasi syempre, especially if the patient comes into your clinic or sa ER, and then of course, syempre, minsan may mga history na rin ng smoking. So, pero may history pala ng asthma ng bata. How do you go about the diagnosis? So, ano ba to? May emphysema, chronic bronchitis, or asthma? So, I mean, parang mahirap bang ma-differentiate ang isa with another?
The test that I've just said, yung pong spirometry, actually makakatulong yun sa pagsagot kung HIka ba to o yun nga, COPD. So yung COPD kasi, it's more of chronic, it's irreversible, it is actually resulted to exposure to smoke, like yung cigarette smoking most commonly. So pag ginawa natin yung spirometer, mababa rin po yung nailalabas nila na hangin from their lungs. Pero pag binigyan nyo sila ng bronchodilator or yung salbutamol, wala talagang pagbabago. Ibig sabihin, mababa pa rin yung hangin. So when that happens, we call it chronic obstructive pulmonary disease.
I see. Okay, chronic is pang matagalan.
Yes,
Obstructive
opo.
means may nakaharang, may
Yun din,
nakabara.
opo, kumikipot yung daanan. Yung sa HIka kasi, pag binigyan namin yun ng pampaluwag ng daanan ng hangin, bumabalik siya sa normal o mayroong significant percentage na acceptable na pwede nating sabihin HIka ito.
So meaning to say, it's highly responsive to bronchodilators.
Yes, it's reversible.
Reversible. As compared dun sa ibang condition na hindi. Kasi hindi yun ang problema.
Yes,
okay.
opo.
And then, that's for bronchodilators. Pero alam natin, in case of an exacerbation, yung matinding atake, nag-work pa ba itong bronchodilators? Or what do you usually give or administer to the patient in that case?
So, there are two kinds of inhalers or bronchodilators kasi. So, meron yung maintenance. So, yung maintenance, yun yung binibigay namin sa pasyente para malaman natin na, or mabigyan natin siya ng control para hindi siya nagkakaroon ng exacerbations or attacks. Pero syempre, if the patient is exposed to these triggers at hindi talaga naiwasan na madami yung load, we give them yung mga reliever medication. So, pwede pa rin yun in a form of an inhaler or via nebulizer or oral like steroids, no? Para makontrol yung pamamaga o yung pagkipot nung daanan ng hangin.
Okay, so it's really necessary na, kasi I'm sure mabibigyan nyo na ng pag nagpunta na sa inyong pasyente, nabibigyan nyo na siya ng iba't ibang klase ng gamot. But despite that, it's still imperative that you get to see your pulmonologist.
Yes.
Kasi nangyari, how do I say that? Kasi madaling makabili ngayon self-medicate. So, hindi nyo alam na mali pala yung minamaintain nyo.
Yeah, so basically, you have to really consult your doctors because they will give you yung asthma action plan. So, bago pa kayo talaga dapat makapunta dun sa exacerbation o yung point na hindi ka na makahinga dahil sobrang kipot na ng airway mo, wala ng oxygen pumapasok sa katawan mo. Dapat bago ka pa pumunta doon, meron ng instructions yung doctors mo on how to handle it.
Yeah.
So, talagang napaka-importante po na meron kang regular follow-up sa pulmonologist mo kasi bago ka pa dumating doon, marami ka pang pwedeng gawin.
When it comes naman sa, age of the patient, so yung age group, nag-iiba pa ba yung management among young asthmatic patients versus the older ones?
Hindi naman talaga nag-iiba, pero siguro yung way lang po to give or what medications to give po, no? Ganun pa rin naman paluwagin yung daanan ng hangin. But syempre, pag sobrang bata, we can't give inhalers. We could give, syempre, via nebulizers. And there are agents that are appropriate for the age as well as the doses. So, ngayon kasi meron na rin tayong tinatawag na pulmonologists. So, better talaga to, yun nga, no, pumunta muna talaga sa doktor to ask ano ba talaga tong sakit na to, bronchitis ba to o asthma na to.